Good day, fellow CICians. Last May 14, 2019, we had our clinical affiliation in Manila for us to have our learning exposure at different tertiary and specialty hospitals and institutions. Our first week was held at the Philippine Orthopedic Center, wherein we were introduced to different kinds and types of tractions, braces, casts, molds, and splints that were used in different orthopedic procedures. We were taught how to apply a balanced skeletal traction and was asked to do a written demonstration afterwards. For the week, we also conducted our individual reportings regarding different orthopedic or skeletal disease and disorders. During our stay at the Philippine Orthopedic Center, we got the chance to tour around the center and see the different facilities and services they offer. We also got the chance to see different types of orthopedic cases, and in here we got the chance to get one case that we are interested in, for us to conduct our case study to be presented at the scheduled case presentation.
For our second week, we were scheduled to have our tour at different tertiary and specialty hospitals and DSWD institutions. On May 20, 2019, we first had our tour at El Sigaches Village, or simply EGV, which was located at Alabang, Muntinlupa City. It was a 16-hectare land area donated by the missionary couple Samuel and Elsie Gaches. It caters people with neurologic disorders that were abused, abandoned, and neglected by their families. In here, we prepared a simple program to bring happiness on our clients even for a short period of time. We presented them a dance that we have prepared and in which they happily joined us. Then, we proceeded to play games. Then after that, we served them the snacks that we have prepared. After interacting with our clients, we were then toured around the institution by one of the staff and was oriented about the different facilities and services they offer, as well as the history and the purpose of the institution. The next day, we visited the Lung Center of the Philippines in the morning. First, we were presented the history, organizational chart, and services offered in the center through a video presentation. After that, we were toured to different areas of the center and was introduced to different kinds of equipment and procedures such as hyperbaric medicine, which provides a patient with 100% oxygenation by entering an enclosed chamber for a period of time. It was used as treatment for non-healing wounds and also for decompression sickness, which was usually experienced by the scuba divers. Another equipment or procedure introduced to us was the linear acceleration, which was used for radiologic oncology procedure. Later that afternoon, we visited National Kidney and Transplant Institute. In there, we went to IVASC, or Integrated Vascular Service Complex, which was the first one in Asia. This primarily served for wound care and wound management and also for prevention. We were also introduced to different equipment in the institution, such as the PET CT scan or positron emission transmission computed tomography, which is a combination of two equipment used to detect activity or growth of tumor of any cancer cells in the body. After that, we went to see the magnetic resonance imaging, wherein we get the chance to see an actual patient undergoing the procedure. Then, we were oriented about lithotripsy, a machine which pulverizes the stones inside the kidney, which will then be flushed in the urine. We also get the chance to see another linear accelerator. This time, we get to see how it moves or how it rotates during the procedure. After touring around to see different diagnostic and therapeutic equipment, we were brought to the institution's museum. There, we were accommodated by Dr. Agkawili and discussed and presented the history and achievements of the institution. We also see different stones removed from patient's urinary system, whether it be kidney, ureter, or urinary bladder. We also get the chance to see two preserved kidneys. One was allegedly belonged to President Marcos, the one which was rejected by his body after an operation. For our third day, May 22, 2019, we went to Tahanang Walang Hagdanan, which is a non-government institution that caters persons with disabilities and provides livelihood programs for them. The livelihood program that they offer consists of making wood crafts, metal crafts, sewing department, packaging of pharmaceutical products, and selling agricultural and recycled products. Tahanang Walang Hagdanan is the counterpart of the Australian institution named House with No Steps. May 23, 2019 marked our last day of tour. With that, we went to the Philippine Heart Center. In here, we were oriented about the center's history, mission, vision, and the different services they offered. Then to start our tour, we were first brought to the center's mini museum, which contains different preserved hearts, presenting different kinds of cardiac disease and disorders, be it on pediatrics or adults. Then, we were shown the art gallery, featuring paintings that were being sold as part of the center's fundraising project. After that, we were toured around the different petals of the building, wherein the hospital ward were located. We were shown and oriented about the different wards, such as pediatric wards, service wards, pay wards, specialty wards, and private wards or suite as they call them. We got the chance to see the presidential suite, which was intended to cater VIPs, more probably the president of the country in case of the emergency. For our last week of affiliation, we spent it at the National Center for Mental Health at Mandaluyong City. First thing in the morning, we joined the center's flag raising ceremony, and in there, we got the chance to see other affiliating students, meet other clinical instructors, and some of the supervisors of the center. After the ceremony, we headed to Pag-asa Hall to have our orientation. In there, the history, organizational charts, services, facilities, and rules were presented to us. Right after the orientation, we got our assigned pavilion, which was Pavilion 4, Ward 3, which was the Forensic Service Unit, Female Ward. For the consecutive 4 days, we conducted different behavioral therapies for our clients, such as dance therapy, for them to feel energized as we start our further activities. Song therapy, for them to express their emotion by singing inspirational songs. Calisthenics, for them to have an exercise. Occupational therapy, wherein we taught them how to make an egg salad sandwich and that they can do this as a source of income once they get the chance to go back home to their families. Followed by music appreciation through arts, wherein we had them listen to music and let them express what they feel while listening to it through their drawings, and then after that, we asked them to share what they drew and the reason behind each artwork. We also did bibliotherapy, wherein we asked them to be the characters of the story that we are narrating to enhance their social and emotional skills. Newspaper reading, for them to be updated about the events outside the institution. And remotivation therapy, in which we presented them a poem about a neutral topic which will motivate them to keep moving forward and never lose hope upon themselves. After each activity was done, we had our individual conversation with our clients for our nurse-patient interaction as documented on our process recording. On our fourth day, we conducted our socialization day. We started this with our normal routine of calisthenics, dance therapy, followed by song therapy. Then after that, we presented them a dance that we had prepared for them. Then we proceed to playing games such as Hep Hep Hooray, Pinoy Henyo, and Pahabaan ng Hininga. In between those games, our clients requested that they have their individual song performances. After that, we had the termination phase of our nurse-patient interaction, and in here, we reviewed our clients' all the learnings that have undertaken for the past days and said farewell to them. For our last day, May 31, 2019, we had our tour around the National Center for Mental Health. We were brought and oriented to the different pavilions such as the Recovery Pavilion, Chinese Pavilion, Geriatric Pavilion for females, Child Pavilion for male which is called Shangri-La Pavilion, Child Pavilion for female or Sonta Pavilion, and we also got the chance to see